Christian Vega, September 17th, 2022.
For this patient, I am positioning her in lateral recumbency. My restraint devices that I'll be using in this video include tape, and since she's so small, I am using lead gloves. They will act as my sandbags, since again she is too small for other sandbags to be used for this type of positioning. Alrighty, so how I would position her, I would start off with the tape. It's placed around the carpus area, and then same concept goes for the hind quarters. She is struggling with this since she's not sedate in any way. Ideally, for hands-free positioning, the patient should be sedate, especially if they're uncooperative or rowdy in some cases. So you can see here, I'm using my tape on the hindquarters, so like around the tarsus area approximately. Then I'm going to go ahead and use my leg gloves, which again are acting as my sandbags, but again she's too small for the sandbags, so that's what I'm using for this video. And the leg gloves are acting, like I said, like sandbags, so she's has the illusion that she's being held. Now moving on to collimation. Right now I'm collimating as close as possible to the site to reduce scatter and exposure. This also helps with the quality of the image. There was a portion that was not included in this video. She was very good for the entirety of the procedure up until the very end. She was able to break free, which is why you're not able to see me place the marker, but I took the radiograph, and here's the radiograph, which includes the marker. The radiographs for abdominal views, usually you're collimating to tooth ringer width caudal to the 13th rib. And it is important to make sure to use a 2-3 finger width caudal to the rib as your central ray for an abdominal view. Also, the radiograph should be collimated cranially from 1 inch cranial to the xiphoid of the sternum and caudally to the greater trochanter to include the coxofemoral joints. As you can see, the diaphragm is clearly visible along with the GI tract, all of your intestinal organs and things of that nature. The bladder would be clearly visible. Is at the most, approximately the most caudal point of the abdomen.